We are now live, senators, and I'm letting you know the rest.
All right. Thank you. This is Senate Health and Welfare. On February 15th, we're resuming our testimony and we are moving to S37, an act relating to access to legally protected healthcare activity and regulation of healthcare providers. And we are joined by Joanne. Let me make sure I'm saying it correctly. I'll let you say it.
Joni Promsma.
Joni Promsma.
Glasses.
Joni.
Oh,
And what we'll do is we're going to go around and introduce ourselves first, and then we'll have you introduce yourself formally and give us your testimony. So.
Okay.
I'm Martine Buick. I'm from Burlington.
Dave Weeks from Rutland County.
Ginny Lyons, Chittenden Southeast.
Terry Williams from Rutland County.
And Ruth Hardy is Addison County, and she'll be in.
Oh, okay.
This is what happens.
Yes, she's from my district.
Yeah.
Okay, she would be here.
Yeah, she will be.
Okay.
And we have your written testimony, which is great.
Okay.
Why don't you go right ahead?
Okay. My name is Joni Promsma. I am the executive director of the Women's Center, which is a pregnancy resource center in Middlebury, Vermont. So I can go ahead with my testimony?
Yes, please.
Okay. Well, good morning, and thank you, Senate Committee, for the opportunity to share with you today as the executive director of a pregnancy resource center that exists to support women and families in our community. With abortion being an extremely emotional and even more so lately political issue, it's more important than ever to have resources that provide women a safe, caring, and non-judgmental setting to explore their options and to learn of support for alternatives to an abortion. My testimony's purpose is to address the proposed section of Senate Bill S37 that specifically targets pregnancy centers around concerns of deceptive practices and misleading information, and to give you a clearer picture of the important work that pregnancy centers do. I was able to watch the testimonies yesterday, and as there was various testimonies in this committee that specifically addressed concerns about pregnancy centers, I'm very grateful for this opportunity to be here today to respond to those concerns and to give you facts and information directly from a pregnancy center. I will note that I have made numerous attempts over the last 5 years to meet with yesterday's first 2 witnesses in their offices, and those offers have been rejected. As of yet, I've either been ignored or only received accusations of hearsay and rhetoric about pregnancy centers that have not been directly addressed with us. Having reviewed the witnesses' written testimony as well as listening to the recordings, I will respond and demonstrate to you not only the false and misleading statements by the witnesses, but also demonstrate the value and the importance of pregnancy centers. Each pregnancy center is an independent organization, so I can only verify information on my center in Middlebury, but I do know the directors of the other 6 centers in Vermont and believe they follow similar practices, and you will hear from a few of them today. I believe that was a question yesterday of how many centers are in Vermont. So there are 7 of us. Allow me to begin. It was stated in the PowerPoint that the goal of pregnancy centers is to prevent what they call abortion-minded women from obtaining abortions, and that the tactic to delay women from making prenatal appointments in order to delay a decision to terminate. With respect to everyone's right to make their own choices, we at centers offer information on abortion as well as other pregnancy choices so that they can make a well-informed decision. We always emphasize for a pregnant woman the importance of prenatal care as soon as possible and even provide them with free prenatal vitamins before they leave. No pressure, no coercion, no judgment. We don't profit from their decision, and some have even returned after terminating because they felt it was a safe place to come. In regards to later testimony to the concern about receiving proper prenatal care as early as possible, we actually get calls from women asking and seeking confirmation of a pregnancy with ultrasound because they are not able to get into their OBGYN office for weeks. We are clear that we do not provide prenatal care, but can confirm a viable pregnancy and gestational age. They appreciate being able to have peace of mind and know that they are still in fact pregnant. Regarding deceptive advertising, our center is committed to 100% transparency in all marketing practices and client interactions. We do not provide or refer for abortions, and we are careful to disclose this fact before setting up any appointments. Clients must also sign a form that, sorry, I messed up where I wrote that, but they sign a form that that indicates that they are aware of that and they are aware that we do not provide those services. We strive to build long-term supportive relationships within our community, which is only possible if we treat every person with the highest standard of care and excellence. The women who come to our center want to explore their options and make an informed decision. Many tell us they were so thankful that someone took the time to listen to them. Most see abortion as their only option and are eager to hear of the support they can receive if they would choose to carry to term. Don't we all agree that we want women to have choices? As far as rebranding from being called a pregnancy center to being a women's center, which was addressed yesterday, the decision was to be more inclusive as we provide supportive services that go well beyond pregnancy. We have had women say they felt a little funny coming to a pregnancy center when they weren't pregnant. We build long-term relationships with our clients if they choose, walking alongside them in parenting, relationship issues, even raising funds and setting up a meal train for a client who needed open heart surgery. We've even been known to assist in installing a car battery when a client was overwhelmed. In the PowerPoint testimony, it was stated that pregnancy centers are nonprofit organizations that function as the backbone of the anti-abortion movement, was a quote, and that the resources of volunteer hours and donations to pregnancy centers far outweigh any other pro-life activity. I can only see this as a compliment to the pro-lifers who provide practical, feet-on-the-ground support to those who are often choosing abortion because they feel like they have no other choices. Again, as I will share testimony from actual clients, and you have that sheet with you, our centers offer resources and support that's certainly not offered at abortion clinics and demonstrates a compassionate and caring environment to empower women to truly have choices. A much more commendable use of their resources than just fighting laws, but as you can see, I'm here today discussing that, so that sometimes is necessary. Statistics were presented also that stated pregnancy centers far outnumber abortion clinics. Again, that seems to indicate that this is a needed service, and especially as pregnancy centers such as those in Vermont receive no government funding, but are fully funded by individuals and churches in the community. I know that was a question asked yesterday by the committee. Our centers save taxpayers thousands of dollars each year as we provide our supportive services all free of charge. I will briefly address the post-abortion stress syndrome that was mentioned as well in the PowerPoint yesterday. We don't use that term. We do offer support for any pregnancy loss, whether elective termination or a miscarriage. As mentioned earlier, we have had women return after a termination to get support from us. We don't want, I wanted to say, don't we want to offer support for those who do struggle with their decision or loss? They need someone there for them as well. Abortion pill reversal was also brought up yesterday. Our licensed medical director supports a woman's choice to have progesterone prescribed to provide an opportunity to try to save the pregnancy if she would like. Progesterone is the natural hormone in a woman's body that is necessary to nurture and sustain a pregnancy, frequently prescribed for high-risk pregnancies. It restores what the first abortion pill depletes. No studies have been completed to refute this, and there are over 4,000 children alive today because of this procedure. What I heard from yesterday's testimony that was probably the most concerning was that pregnancy centers function, quote, under the guise of being medical facilities, end quote, which I know for the Women's Center and the other pregnancy centers in Vermont that offer medical services is a false accusation. Medical services provided by our center are provided in accordance with all applicable laws and in accordance with pertinent medical standards under the supervision and direction of a licensed physician. All our scans are carried out by an RN trained in sonography and are reviewed by our medical director, a licensed OB/GYN. Our medical director reviews and approves all of the medical information that we provide clients, including the risks of abortion, as well as approving our medical policies and procedures. Our ultrasounds are in fact diagnostic and provide confirmation of a viable pregnancy, the location of the fetus or embryo, and determine the gestational age. This information about a pregnancy becomes more important as medication abortion becomes more readily available and no longer requires a clinic visit. With telehealth abortion, there is no ultrasound to confirm the gestational age, which is crucial as it is not a safe procedure after 10 to 12 weeks. LMPs, which measure the gestational age, are many times unknown, and therefore with no ultrasound to confirm, women are at risk. As this committee addresses concerns of deception, I was very concerned when I attended a presentation last year by yesterday's first witness, where a website was shared about how to obtain abortion pills via mail. The website stated that if one took the abortion pill and had to go to the ER, do not tell the physician that they took the medication abortion, since their symptoms would resemble a miscarriage and they did not need to know. To me, that was very concerning. Data privacy was mentioned as a concern because we collect client information and are accused of sharing this information. We are HIPAA compliant and hold all client information in strict and absolute confidence. Information is only disclosed as required by law. I will briefly address yesterday's testimony regarding the reported clients who have claimed that they have felt deceived by the Women's Center, our center in Middlebury, or have felt coerced or received inaccurate ultrasound results. First of all, I would expect that a complaint would have been made or filed somewhere if this were true. We offer every client an opportunity to provide feedback and invite them to review us on a platform such as Google. At this point, we have only received 100% positive reviews and client satisfaction. The only exceptions are a few Google reviews made by individuals who have no verification of ever being a client at our center. I've included in the provided materials review comments collected from actual clients from the last year or two. So one question I had for this committee, are you aware of any filed complaints about any of the Vermont pregnancy centers? You're aware?
We haven't taken testimony on that yet.
But I mean, there hasn't in the history been any
I
filed
have no
complaints.
idea.
Okay.
Yeah.
If I could make a suggestion as I end this, out of concern to protect Vermonters from deception and misleading advertising, perhaps as legislators, you might consider a bill to include all organizations that offer services to the public and not just single out pregnancy centers as presented in this bill. In conclusion, I'm happy to report that the Pregnancy Resource Center in Middlebury, Vermont has been aiding Addison County women and families for nearly 40 years. In 2022 alone, we provided services to 90 individuals. Women come to us for the abundance of services we do provide, which include pregnancy diagnosis, prenatal health classes, post-abortion care, diapers, vitamins, baby clothing, strollers, furniture, and other materials. This is a vital resource in our community that needs to be protected and not be targeted because of differences of view. As I was encouraged a few years ago by a leader of our community, a leader in our community of an organization, after being verbally attacked in a public event, that we may have ideological differences, but we are all here to support women and families. Thank you for your time and consideration. If you have any questions, I'm happy to answer.
Thank you. Yeah, I will ask a question, but
Sure.
I appreciate your taking the time to respond to some of the testimony that was in our committee yesterday, and
Mhm.
appreciate the work that you've done to bring us this information. Thank you.
Mhm.
And I do have the question, you've answered some of the questions. There is, you do have a medical director
Mhm.
who is OBGYN.
Yep.
Is that person dedicated to your center and available on a consistent basis to your, to the folks who come in?
Our medical director is not physically present at our center. We have a nurse that he oversees.
Okay, and so the nurse is then there,
Correct.
regular basis. Okay, that's helpful. That answers some of the questions that we had. And then In terms of the ultrasound, you've indicated that that's done by the nurse. And then does the nurse have the training then to evaluate and report on the timing of pregnancy and so on?
So what we do is we send it to electronically to the medical director who reviews it, and then we give her the information.
Okay.
I mean, she can do the ultrasound, but he reviews it to confirm what she.
And then the other question about the medical director, I'm going to keep going for a little bit, and I know others have
Sure.
a question. Does your medical director also serve as a medical director for the other centers, the 6 other centers in the state?
Well, not all of the centers are medical,
Okay.
offer medical services.
Okay,
But I believe he does for 1 or 2 of the other ones, but
Okay.
not all of them.
okay.
Some have different medical directors.
So they do have that.
Yep.
And then you've alluded to the ethical piece that we talked about yesterday, talked a bit about funding, but also the other, I'll leave that one aside for a minute, but the question, when folks come in, you indicate that you're not going to provide information about abortion or abortion referrals.
We do provide information, but we do not perform nor refer for an
You
abortion.
don't provide. Do you indicate to the clients who come in, I think you referred to them as clients, not patients, is that
Correct.
Okay. When your clients come in, do you inform them about what is legally protected healthcare for the state? So certainly abortion is legally protected in the state of Vermont. Do you inform them that that is the case, or just
Yeah, I
simply
mean-
that you don't refer people?
I mean, I don't think we specifically, unless it's a question,
Okay.
can I get an abortion in Vermont? And we would tell them, yes, you can. It's legally protected here.
And then in terms of contraception, do you have any guidelines around use of contraception or
No.
services?
Yeah, we have some information about different types of contraception, but we don't recommend or refer or provide for contraception. We just, again, it's mostly information and education.
And so then you also referred to other clinics as abortion clinics. So feeling that there's the same value placed on other clinics that might have more holistic counseling that might include abortion. So I think we all have to be careful of our language.
Sure.
Yeah. And then I think that's it. I do appreciate what you have brought to us very much and the testimony. And then you also brought your client comments, which is helpful.
Yeah, and I also attached the commitment of care and competence that just is some guidelines that we follow.
Okay. Okay. And then, yeah, good. And that gets to the ethical issues that we were looking at. Senator Weeks.
Well, thank you. And thank you for coming in to testify. I think it's very important to offer counter arguments, responses, et cetera, to others' testimony. So to find balance. So I appreciate that. I do agree with Chairman Lyons that characterizing a fully staffed OBGYN facility as an abortion clinic is a bit of a step too far.
Oh, I wasn't implying, I'm sorry if I implied that. That wouldn't be the language I would use.
That's what I heard.
Okay.
Senator Hardy. And then,
Thank you, Madam Chair. Hi, Joni. I'm sorry I wasn't here at the beginning. I'm
That's
Ruth
okay.
Hardy,
Yes.
and I look forward to the visit in a couple weeks.
Yes.
I guess you provide actually a lot more medical services than I expected, in terms of you have a nurse on site, you have a medical director that's overseeing things, you're reading sonograms, you're providing prenatal care, apparently.
No prenatal care.
Vitamins and
Just vitamins,
advice
yes.
and talking to somebody about their pregnancy and what they should be doing. Do you refer them to actual OBGYNs?
Oh, absolutely, yeah, we strongly encourage and let them know who's available, and yeah.
Do you have a referral sort
No,
of?
we don't do official referrals. I mean, if somebody, we have had requests for the ultrasounds to be sent to them, and if that's what they would like, we'll release that information.
So you don't work with other medical practices or actual medical practices in the greater Middlebury community?
I mean, I'd love to have a better relationship with Porter Women's Health, but we haven't really had that. I mean, we just let them, we're a supportive setting for education and information, and the information is medical in the sense that we are there to help confirm a pregnancy. That can only be done with an ultrasound. A pregnancy test doesn't confirm a pregnancy. And then to give them information about their options and can be helpful in a supportive environment. So I'm not sure when you said that you were surprised at how much medical services we provide.
Well, your testimony talks about the medical services you provide. And sorry, I have too many tabs open, but
That's okay.
you were talking about that your licensed medical director supports a woman's choice to have progesterone prescribed and to provide an opportunity to try to save the pregnancy. And you talk about how your medical director does that, and that you have a licensed OBGYN and an RN on staff. And I mean, you say medical services provided by our center are provided in accordance with all applicable laws and in accordance with pertinent medical standards under the supervision and direction of a licensed physician. That is a statement about you providing medical
Right, so the medical services that we provide are limited in that they provide only the diagnostic ultrasound and the pregnancy test. And yes, we do provide the prenatal vitamins.
And also apparently hormone.
No, we don't provide that at all. Our medical director would support a woman who wants to do that, and he would assist in her getting that. We don't provide that ourselves.
But he's your medical director that then talks to the patients who come into your office.
He would just provide that outside of our office. He wouldn't do that as part of our center. It hasn't ever happened.
Sounds like he would, but and then it sounds like you also keep medical records. You say you comply with HIPAA and that you keep everything confidential. So do you have an electronic medical record system or a paper medical record system?
We have an electronic.
You have an electronic medical record system. Do you ever have any kind of sort of inspection or any kind of oversight from the Board of Medical Practice or from the Office of Professional Regulations or the Department of Health or anybody who's coming to confirm that you're complying? Or is this just your statement saying that you're complying, or do you have?
That's our statement. We have we're not a covered entity, so we're not legally bound by HIPAA, but we do follow HIPAA regulations.
Okay.
Not because we're legally bound to, but.
Well, if you're providing if you're providing medical services, even if they're free medical services, you are bound by HIPAA and you have to comply with all medical requirements, as far as I understand.
Yes.
But you yourself say you do, but you don't have verification from any medical authority that you do.
Someone's welcome to check if they would like.
Okay, well, maybe we will do that.
Thank you. Okay, and just in the interest of time, I'm gonna suggest we move on to the next witness, and because we do have this is not usual for us, but we are a little bit fine today. So thank you very much for your time and for being here with us.
Thank you for allowing me to be here.
Yeah,
Thank you.
thank you. All right, and so we have Jean Marie Davis here.
It's out here.
Jean Marie Davis is here. There you are.
Morning.
Good morning and welcome. And you are the executive director of the branch's Pregnancy Resource Center. And I understand that Deb Kuchar, who is on our agenda, will not be testifying just time. She's there. I see her hand.
Yes, yes. So I will try to be quick and hopefully be able to answer questions and clear up some clarifications that was just asked on some with medical questions and things like that. So hopefully we will be able to move forward so that Deb can also speak as well.
So we have your written testimony. Do you want to briefly offer some comments?
Yep, sure. So as you know that I am Jean Davis. I am the director of branches PRC in Brattleboro, Vermont. We are the only center right now that is, and I say right now, that is not medical. However, I do come from being at the hospitals, working at 2 different hospitals in Massachusetts and in New Hampshire, and I was in the HR department. So I know about the audits and the OSHAs, and also with the CDC guidelines, and also with working with the Department of Labor. With that, I wanted to talk to you guys just a little bit about a client standpoint, because 8 years ago, I was actually a client before I became a director. So you're going to hear an actual live testimony real quick. So I'm a survivor of human trafficking. I was trafficked in the United States for almost 20 years. I'm 38, I will be 38 this year. However, my first trafficker was my father, and then continued on throughout my life. I have 2 children. Both of them are out of the product of being human trafficked. My oldest is with my family because I was young. I was 20 when I had him. And because I was continued to be trafficked by many different traffickers over 33 different states, I had to leave my son. At the age of 29, I decided to leave my traffickers. I probably will cry. I'm very sorry. It's very hard sometimes to talk about my testimony. So I was 29 and I needed to leave. I was done. I had found out that I was pregnant, and I wanted an abortion because I did not want to have a daughter who maybe had been raped or molested or any type of way. And so I didn't want to deal with that. I got to New Hampshire on August 19th, 2014 is when I arrived in New Hampshire. I was running at that time from traffickers. And if you know anything about human trafficking, you will know that the traffickers will threaten their products. We are called products. We're not called women, we're called products, to stay because we make their money. And so I left. I then went into a DV shelter, which they kept me safe in New Hampshire in the Monadnock region. At that time, they told me about a faith-based program, which I very interestingly, a lot of people have not spoken about that. We are a Christian faith-based program. We believe in Jesus Christ. So with that being said, they let me know that this was a faith-based program, that it was a pregnancy resource center that can help me out. At that time, I was a Jehovah's Witness. So I just want to let you know that I had no clue, had no idea about what Christianity looked like when I went to their center. When I got to their center, they offered me and said to me, "How can we help you?" I broke down and cried and told them I need some help. I had no clothes. I had only 4 pairs of outfits. I had not even decided to even get clothes for my child because at that time I was 5.5 months pregnant, and I never once, and I did go to hospitals. I did go to different places, but because of the time frame, they never allowed me to do an ultrasound to see my child. So when I was at the Pregnancy Resource Center in Keene, New Hampshire, her name is Phyllis Phelps. So it was the client services manager at the time, and the woman Audra Wilson, who was the RN for that center. She then took me into the room to do an ultrasound, and that is when the first time I ever saw my child. And that's when I said, I'll keep my son, or I'll keep my baby, but I need help. So the center then decided to help me. I'm sorry. They told me about a program. They told me about a program that can help women because I was homeless and I had nowhere to go, because I looked at her and I said, now what? You've convinced me to keep child. because I found out I saw that at a baby. Now what? And so she told me about a program. And I said, I'll go into it if they'll take me. And she said they once again let me know that it was a faith-based program. They did not hide anything when it came to their religious beliefs or anything like that. They let me know up front. And I said, okay. She then offered to share the gospel with me. At that time, I accepted Jesus into my heart and I went into the program. I then delivered my child. When I was in the program that I was in, they took me to the hospital. They got me connected with an OBGYN down in Manchester, New Hampshire. I went to the OBGYN. I then went to the hospital. The hospital then helped me out. I delivered my child. My son then, after that, the director and the CSM came and visited me, provided clothes and gifts for me, checked on me to see how I was doing. I actually still to today still speak to them. As now a director, I then not only did I graduate from the women's program, I then went on into become I went to the College of North Point Bible College. I got an associate's degree in biblical theology. I then went and worked at a program for women and children that help women just like me, because a resource center, and it's very funny, a lot of people focus on the word resource on pregnancy. Me being the new director at the branches, I tell all of my staff members, we focus on resources. We don't just focus on the pregnancy. That is 1/8 of our programs that we provide for them and services that we provide. But because our center does not have a medical, have a ultrasound system to do sonograms, we focus on resources, meaning if they need a job, if they need help. So I have connected with the different places of jobs of saying, hey, if I have clients that need a job, can they come and apply here? I have banks that are willing to come and do financial pieces with them. I have a conversation with the police station and the chief's department to help if a woman who is human trafficked, just like me, or a woman who's in a domestic violence and they're wanting to get out of their situation, how do we set up a protocol to get them out? And I have all these things set up to where we are connecting with the cities, the homeless people as well. If they need help that are homeless, that don't have any money and they need clothes. I had a woman come in who needed clothes for her child. They can get anything they need for free. We don't charge any of these women. They never charged me. And now that what we say in our center is we do life with each other. I go to Boston, to Mass Ave, to where people actively shoot up heroin, and I tell them about Jesus, and I give them hygiene kits, and I tell them, you know what? I was there at one time. I have been off of crystal meth for almost 9 years now. I haven't been in human trafficking. I now advocate for human trafficking. I also have written a book explaining how I got out of human trafficking and how the Pregnancy Resource Center saved my life. I would be dead right now if it wasn't for this place.
Oh, thank you. Thank you very much for your testimony. We feel your emotion. Thank you. You've been through a difficult time, and it sounds like you've landed on your feet, which is terrific.
And that's what I'm hoping that you guys understand, that that's what we always do here. I'm not just the only one that has landed on my feet.
Yes, we
There's
understand.
been other women that have landed on their feet as well.
Thank you. And our concern here is ensuring that folks have all the information that they need and that it's medically appropriate information and so on. So we very much.
And with that, I understand. And that's why I let you guys know that I did work. I worked at Monadnock Community Hospital in Peterborough, New Hampshire in the HR department. And I also worked in the Gardner Hospital in Massachusetts in the HR department, and worked with OSHA, worked with the HIPAA laws and understanding all those things. So when it comes to, as the lady asked, if there's an audit that goes around, which is usually, it used to be once a year, but because of the COVID, it was relaxed because of COVID, but then they have come back. And we have those things set up to where they can do an audit through NIFLA is the program, but they can do an audit if they would like with OSHA and with the CDC guidelines.
Thank you. And I think because of our time, we're going to call it a wrap, but we appreciate your being here with us, and we can get in contact with you as needed. So thank you.
Thank you.
For all your work. It sounds like you reached out from Vermont to other places, and it's terrific. Thank you very much.
Thank you.
All right. So committee, we're still on S37, and as I indicated before, the Attorney General is testifying next week. They're all busy at a conference somewhere, so we'll pick up with them when they're back in state. I did want to get to some of the further discussion with Ledge Council on S37. And we are also going back to S56 to talk about the child care and early childhood education. Alex, let me ask you a question. Just hold this thought for a minute. Are the Head Start people on in the waiting room?
Yes, they're in the Zoom waiting room right now.
Okay, well, let's do that. Let's respect their time. And we'll move away from S37 very briefly for a few minutes to hear from the Head Start folks on S56, the early childhood bill.
I'll let them into the.
And then we'll jump back. This is how we work. It's called leapfrog.
Chair, can I ask a quick question? Are we gonna jump back to testimony on pregnancy services centers? Or are we jumping back to S37?
No, we're jumping back to S37 markup.
Okay.
Yeah, because Deb
Great.
Kuchar was there. I believe she was there with Jean Marie, and she had indicated earlier that she would be fine having not
Yeah, I
testifying.
just wanted to verify.
Yeah,
Thank
we
you.
weren't just categorically eliminating anybody. Okay, we're good. So, Head Start, can you let them in?
Yes, hold on.
And we have a lot of
Okay,
different,
thank you.
today is a whole lot of different days. Today's Creative Economy Day and Citizens, Champlain Citizens Advisory Day. Whether we get to those or not is debatable. Good morning.
Good morning.
Is Paul Berman
He's joining now.
is joining
Joining
us?
is,
Are you two testifying together?
we are testifying together, yes.
Oh, good. Thank you all. Why don't we have you introduce yourselves for the record? Our time is precious this morning. So I think you have submitted some testimony.
You have some documents. I just uploaded one more piece for you, and I know that Paul submitted some things last evening. So I will start by introducing myself, and then I'll turn it over to Paul, who's really going to take the lead in this presentation. My name is Deborah Gass. I'm the Executive Director of Early Education Services here in Brattleboro. We cover Windham County. My program is unique in that it is, of course, one of the Head Start programs in Vermont. We are also one of the Vermont Parent-Child Centers, and we are administered through the Windham Southeast School District. So we kind of cover all the points that this bill touches upon. And I've been here now for 21 years. I have a long record with Head Start. I did this in Massachusetts prior to coming to Vermont for about 17 years. And I started my career in North Hollywood, California as a childcare director there. I also am an instructor for Community College of Vermont and Springfield College. And I have years of experience working as a consultant all over the country. So I'll turn to Paul and let him introduce himself and take it from here.
Great. Thank you, Deb. Thank you, legislators. I really appreciate this opportunity. I'm going to screen share. I include my introduction in this presentation, and Deb will join me for the presentation. So I want to start with a thank you. I am honored to be of service to you today, as I know Deb is as well. Just quick background on me. For the last year and a half, I've been a private consultant, trainer. This follows 20 plus years as a Head Start director in Northwest Vermont. I was chair for Vermont Head Start Association for the better part of the last 20 years. I remain on the board, as well as New England Head Start Board. I've done a lot of work at the national and state levels, Office of Head Start, Program Management, Fiscal Operations, National Head Start, as well as being a gubernatorial appointee some years ago to the Vermont Blue Ribbon Commission on financing high quality, affordable childcare. I bring to you today a lot of lived experience as a Vermont ECE programs administrator. And then, as I said, knowledge gained through over the course of my entire career, 25 plus years in Head Start management, advocacy, and consulting work. Background, many years ago, I was a lawyer. I remain a service-oriented leader and a social justice advocate. We're delighted, as I say, to have this opportunity to speak with you today. And Deb and I talked about this presentation that she mentioned I had prepared before she and I had the opportunity to collaborate. So she's going to jump in on a bunch of my slides, but I want to give you a quick roadmap. We'll do a quick Head Start overview just to refamiliarize folks with the Head Start program. We'll talk about, from our perspective, what we see that is absolutely wonderful about S56. We'll talk about some concerns that we have with S56, and then we'll talk about what we see as opportunities for the evolution of Vermont's early care and education system, and then we'll wrap up with a thank you.
I'm just going to say that given we had scheduled you for 15 minutes total.
Oh.
And it looks like, I'm just saying that we can't go beyond that, unfortunately.
Yeah, thank you, Senator. Thank you, Senator. We had understood we had from 11:15 to 11:45 this morning on the schedule that was presented to us.
Oh, you're right. So go ahead. We'll have to sacrifice ourselves. That's fine.
Okay, thank you.
Yeah.
So let me begin. I'll just do a high-level overview, and then I know Deb wants to jump in on some of the Head Start background. So very quickly, Head Start programs are national, federally funded child and family development programs that provide high-quality, comprehensive education and development services for very low-income children, up to 130% of the federal poverty level, and social services for their families. Head Start actually has two distinct programs. There is the Head Start program, which serves preschool-age children, ages 3 to 5, and their families, and Early Head Start, which serves primarily pregnant women and infants and toddlers, primarily birth to age 3, and their families. Part of the uniqueness of Head Start is the comprehensive nature of the services. And the services for children, which are designed to promote school readiness, include early education, health, nutrition, and mental health services, and services for children with special needs. And then the services for parents, as a 2-generation program, promote family engagement and include parent leadership and social service supports. Head Start programs nationally are high-quality, research-based programs, tremendous accountability, and proven positive outcomes for children. We'll unpack just a few details on each of those core elements of the Head Start service. Deb, did you want to say?
I just want to jump in and add
go ahead.
just to highlight one point about that first slide. What's important to know is that the way the federal government funds us with Head Start and Early Head Start is that we are given allocation for a certain number of Head Start slots in one budget and Early Head Start slots in another. We can combine the budgets, but we cannot interchange those slots. So we contract with the government to provide a certain number of Head Start slots and a certain number of Early Head Start slots. They are not interchangeable.
Right. Thank you, Deb. So as I begin, as I was saying, just a few more details about Head Start. So the 3 core components of the Head Start program nationally are early education services, health service coordination for young children, and social service supports for families. In terms of the education services, the federal regulations for Head Start require research-based curriculum as well as child outcome assessment. In our case in Vermont, those processes or those areas are aligned with the Vermont Early Learning Standards. We have a significant focus, especially around children's social and emotional development, as well as cognitive and physical. As I said earlier, the education program is specifically designed around school readiness and transition to kindergarten. And then we have expertise in serving children with special needs and individualizing for all children. By federal regulation, a minimum of 10% of Head Start slots are allocated for children with special needs. In terms of coordination of child health, begins with health, behavioral, and developmental screenings, medical, dental, and mental health services, food and nutrition, assuring that children have health providers, meaning pediatrician and a dental practice. We also assure that children are up to date on their EPSDT schedule of well child care, meaning they're up to date on their physical exams, dental exams, and then we support families in getting children into specialized care if there are any outstanding health issues which require that service. Typically, we see things around vision, hearing, respiratory, sometimes oral health and decay, those kinds of issues in general. Finally, family engagement and social service support. We do individualized home visits with parents to promote child engagement in children's development and learning. We assist families in accessing social services and community resources to meet their needs. And again, this is part of the structure of Head Start nationally is as a 2-generation program. We really work with families with low income who have pretty extraordinary stressors and challenges in their lives, many with significant trauma histories, children with adverse childhood experiences. We're really serving some of the most vulnerable populations nationally and in Vermont. Anything else, Deb, before we turn our attention to what's wonderful?
Nope, I think you've got the green light.
All right, thank you. So let me turn to one of my heroes and icons in the world of early childhood education, the extraordinary Mr. Fred Rogers. I'll take a little bit of liberty with a Mr. Rogers quote. So Mr. Rogers said something along the lines of, "So the greatest thing that we can do is to find what is healthy and laudable about this particular legislation and reflect that to the Senate Health and Welfare Committee. It's a large assignment to be able to help people look deep within this complicated 100+ page piece of legislation with a lot of legalese and find what is wonderful in there, because at the core of all early childhood legislation in Vermont is something wonderful." So Mr. Rogers said something like that. We want to begin with really what's wonderful, and that is your leadership in the development and investment in Vermont's early care and education system. We want to thank you sincerely for prioritizing the continued development of Vermont's ECE system for the benefit of Vermont's children, families, and workforce. Your willingness to pursue increased public investment and systems development for Vermont's ECE system is outstanding, and we really appreciate you. So we just want to start with that tremendous thank you. This is just a watershed moment. We appreciate it. In terms of the details of the legislation, you may have heard from others. I know Deb has some specific comments. We think that probably all of the enhancements around the Child Care Financial Assistance Program, CCFAP or CCFAP, are all tremendous. Deb, do you want to expand on some of those?
Sure. I'm going to go right to the third bullet first, because I really have a personal connection to switching to the enrollment-based payment system instead of attendance-based payments. The last time I testified, this is a point that I was really enforcing, and I am delighted to see that it's included in this bill. It really makes the difference between, or it makes it possible to keep our doors open. For without it, we would not have the reliable income to be able to staff our program and operate our program. And that really echoes the way we are funded with Head Start. So in my agency, we rely on Head Start funding and Vermont Child Care funding to provide a full day, full year program for our families. And we wouldn't be able to do that, or we've struggled in being able to do that with an enrollment-based versus attendance-based system. So thank you for including that, and thank you for hearing us.
Wonderful.
Do you want to pick up the other points, Paul, or you want me to keep going?
And yeah, Deb, anything on the CCFAP you want to mention?
Okay, calculating the payments to programs based on cost of care, inclusive of increased compensation for early childhood educators instead of market rates. It's really, really critical that we are doing that in our own communities. And that's a wonderful piece that's included in this. Expanding eligibility for families for up to 450% of the federal poverty level by July of 2024. That, from my parent-child center and my state-funded perspective is wonderful. It really opens the doors for more families who need care to have that opportunity. Removing all work, education, and health eligibility requirements so that eligibility for CFAP is determined solely on family income. Again, I can't speak enough about how much that is necessary and how that opens doors for families to be able to access the education and the care that they need for their children. And creating a non-citizen childcare assistance program for families who are not eligible for CPAP due to citizenship status only strengthens our communities. Thank you.
Fantastic, Deb. Just to reiterate, what Deb said, we see all of these as innovations that will positively impact children, families, the workforce, and the system. The other things that we think are fantastic in the bill include the tiered professional compensation standards for employees, the new property tax exemption for family child care, home programs, the staff retention payments to child care programs, and the early childhood educator scholarships. All of this is tremendous, and we just deeply appreciate it. In terms of concerns, and some of these concerns I know you will be hearing from other stakeholders or have heard, we want to echo some of these concerns and then maybe dive a little bit deeper. So the three major areas of concern are, first, the sweeping changes to Vermont's UPK system, and we'll go into that detail just a bit. Second is significant governance changes which do not align with the recent analysis which was commissioned by the Vermont legislature. And the third are potential unintended consequences with substantial adverse impacts for Vermont's children, families, and workforce. So we'll begin with the sweeping changes to Vermont's universal pre-K program that would have consequences for families and childcare programs. The first is, this legislation, as you know, requires all public schools to offer universal voluntary full school day, school year pre-K to all 4-year-old children in their district. I know Deb's going to comment on that. It removes 3-year-old children from the universal pre-K program. We're concerned about that. And it removes private partner programs from the UPK program. And we see issues there also. Deb, do you want to run with some of those?
Yeah, I'll just make a couple of points. One is that, as I said earlier, the Head Start programs are funded to provide 3 and 4-year-old programming for 3 and 4-year-olds. And I know that if we were to move to a model where those slots are only allocated for 3-year-olds, we would have some great deficits where there are many of us, my own program included, that would have a hard time if we moved all the 4-year-olds out of the program, finding enough 3-year-olds to fill those vacant slots. And one of the big concerns that we have is that our programs, as I said, are year-round, predominantly year-round full day. And we are concerned about what would happen to 4-year-olds who would lose those full day year-round services, including the summer months, and what happens to children who, especially children who are living in poverty. We know from research that they need that continued momentum in order to be ready for kindergarten, ready for school. And with those services dropped in the summer months, they could fall behind.
Thank you, Deb. And the last thing I'll add to what Deb said is, the other concern about the potential for all 4-year-old children being served, through the public school-based pre-K programs. The implication of that is many of those 4-year-olds who are currently being served through Head Start programs across the state would no longer be recipients of Head Start services. They would be receiving, pre-K services through the schools, which I'm sure are of great quality. The concern is that the children would lose the Head Start comprehensive services. They would no longer have the child health service coordination work that we do on behalf of some of the most vulnerable children. The families would no longer be in receipt of the social service support that we provide to some of those very precarious families. So that's part of the concern that we have around that piece. Second major area of concern is that there are significant governance changes that do not align with the recommendations of the Vermont Child Care and Early Childhood Education Systems Analysis final report that was recently commissioned by the Vermont legislature and released last year by Watershed Advisors and Foresight Law and Policy. And you'll see in this presentation, which is uploaded, for the record, all of these are hyperlinks, to all of these resources. First, S56 reflects more continued suggestions regarding the shuffling of AOE and DCF/CDD oversight with more prospects for a bifurcated rather than a unified Vermont early care and education system. There have been prior proposals in recent years about this sort of bifurcated approach. None of them have succeeded. So we don't think that that's a good direction to be going. S56 fails to reflect the major recommendations of the report commissioned by the legislature for a unified ECE system governed by a newly created single unit of government. And the specific language from this report says, we believe that the most important change the state needs to make is to create a single unit of government focused on early childhood, one with elevated leadership and unified authority over a broad set of programs, likely including at least universal pre-K, child care, which means infant and toddler services, children's integrated services, and the Head Start Collaboration Office. This unit would be responsible for setting the state's vision for early childhood, managing different program funding streams and seeking to knit them together into a more coherent whole, setting standards for quality and supporting ongoing program improvement, supporting professionals, engaging stakeholders, including families and providers, and clearly communicating to early childhood providers and about the early childhood system to a broader audience. This is visionary. This is the kind of visionary governance that we really need in the state of Vermont and that we can achieve in the state of Vermont. So we would like to see the legislation modified to really go in this direction. Finally, the last concern with the bill as presented are the potential unintended consequences with substantial adverse impacts for Vermont's children, families, and workforce. I hyperlink this scholarly piece from the Center for American Progress titled "Investing in Infant and Toddler Childcare to Strengthen Working Families." I highly encourage this committee to read this report. And I quote from the report, "The tendency of many states and cities has been to invest in preschool since they can link these programs with the public education system. While preschool is an excellent public investment, child care policy should begin at birth rather than in the year or two before kindergarten. In fact, a preschool-only approach can have unintended consequences on the price and supply of infant and toddler childcare. Many providers use revenues, and this is the case in Vermont, from larger classes of older children to subsidize the high costs associated with infant care. When public preschool crowds out the market for private tuition preschool, providers can no longer cross-subsidize the cost-intensive care of infants and toddlers, leading to fewer slots and higher prices. So these are the kinds of consequences we envision if the bill were to be enacted as written. We want to jump to what we see as opportunities for the evolution of Vermont's early care and education system. And we think that S56 is a great start. So first it begins with, and we have no misconceptions that we're going to be able to achieve the gold standard through this particular legislation, but just to begin with understanding what the gold standard looks like. The gold standard would look like full public funding for care and education for children ages birth to 5. I include an asterisk here to say we shouldn't take our eye off of high quality prenatal care, but the issue is really when children are born, we often need high quality providers to care for those children. And so this gold standard would be akin to full public funding for the care and education of children ages 6 to 18, which we currently have in our K through grade 12 system. Unfortunately, as a society, to date, we have failed to invest sufficiently in the most critical years of children's brain development. Therefore, we have failed to reap the rewards of that investment for the quality of life in our communities. So issues like educational attainment, health, poverty, racism, environment, crime and corrections, we miss the opportunity to make substantial progress on all of those kinds of issues. What we would suggest is building the system toward the gold standard with this legislation. As a society, we should begin with investment and systems development for infants and toddlers and their families first. So these are the recommendations, and we want to sort of break it down into children, families, workforce, and then look at what we would consider the roadmap to getting there. So the first is some recent research coming out of the Center for the Developing Child at Harvard University. And that research is telling us that prenatal to age 3 is critical, not just for brain development and school readiness, but for lifelong health and development. The quote is, "A growing understanding of how responsive relationships and language-rich experiences for young children help build a strong foundation for later success in school has driven increased investment and sparked innovation in early learning around the world. The rapidly advancing frontiers of 21st..."
Did you have a question?
Yes.
Did you have a question?
I'm confused by this testimony, because is he insinuating that S56 doesn't do any of this?
I'll just wait and see what he said.
Okay.
Did he freeze?
We're having a
I think I froze him.
We're having a freeze
Yeah, can you hear me?
in the middle of
We can hear
February.
you fine.
Can you-
Okay, we can hear you, Deborah.
Okay, but we lost Paul, so I'll pick up where we lost Paul. The rapidly advancing frontiers of 21st century biological sciences now provide compelling evidence that the foundations of lifelong health are also built early. Oh,
Yes.
now we lost his screen. Maybe he'll be jumping back on.
We have it on our computer.
We're looking at our screen and we're on slide 9.
Okay, so let's see if I can get to it because I don't have it.
Okay.
All right, let me see if I can get to it. Sorry about that.
Can you provide the testimony without having the slide?
I can, yes, I can.
Why don't you proceed with that, and then if he shows up, we'll go back.
Okay, so let me see. So, what can I tell you? What, you know, the essence of what the section that we were looking at is that we really want to encourage you to think about building the infant toddler field before we, you know, as the first step in making the intent of this bill successful. Here comes Paul again. And we're going to talk a little bit about what's happening in the field of infant toddler care. And I can use my own experiences as an example of that. Here in Windham County, we do have an early Head Start program and we have a Head Start program. And I have been unable to open 3 of my early Head Start classrooms since the pandemic, and 1, sometimes 2 Head Start classrooms because I cannot find staff. And so there's clearly a need to build more infant toddler childcare providers, teachers in Vermont. That's where we have the biggest gap. So, you know, if we shift more preschool slots away from the programs with the idea that would open up doors for more infant toddler care to happen in Vermont, I like the concept, but the reality is that we don't have the staff to make that happen. And we need more training. We need, we need dollars to pay these folks. And of course, there is some of that that's included in the bill. And so, that's a point that I wanted to make. And I think Paul is back with us. So I'll let you pick up where we lost you, Paul.
Thanks, Deb. I don't know what happened, but I was just finishing with the compelling case for children. Let's talk about families. Infant toddler care is expensive and supply is scarce. This data comes from Stalled at the Start, Vermont's Child Care Challenge. And so what we see is in the state of Vermont, we have nearly 6,000 plus the need for 6,000 plus infant toddler slots versus the need for about 2,700 preschool slots. So infant toddler care, much more expensive, much more scarce. The cost of infant toddler care most adversely impacts middle and low income families and women. Again, I cite the Center for American Progress on this, but the consequences are most severe for middle, low income families and women. Finally, for workforce, strong theory number one, we need data on this. Within the ECE system, there is a higher percentage of vacancies in available infant toddler teacher jobs than in available preschool teacher jobs. Deb knows this from her firsthand experience with her program. The general consensus is it is much more challenging to recruit and retain infant toddler teachers than it is preschool teachers, likely attributable to the wage deficit. This was the best wage data I could gather on short notice. We need to seek more clearly defined data, but essentially the theory is within the current ECE system, infant toddler teachers have the lowest average wages in the field by our estimates to date, maybe $15.84 an hour for infant toddler, $18.84 for preschool, and then it jumps considerably for public school teachers. Finally, how do we get there? So the way we get there, in our estimation, is through three primary strategies. First, high quality program models, which drive funding and investment plans. Second, innovative high quality governance systems. And third, world-class modernized delivery systems and services. In terms of high quality program models, which drive funding and investment plans, we'd recommend updating the high quality program modeling and cost modeling built upon and extending the work of the Vermont Blue Ribbon Commission on financing high quality affordable childcare and using modernized program and cost models and community data to then drive the funding and investment levels and plans. Innovative high quality governance systems. This would be creating a single unified Vermont ECE system governed by a newly created single unit of government. And finally, world-class modernized delivery systems and services. We want to accentuate the positive, continued development and expansion, high quality new programs and expansion of high quality existing programs, a professionalized workforce, qualifications, compensation, benefits, working conditions, better systems and service integration with health, mental health, and family services, modernized infrastructure in terms of facilities, transportation, technology, and so forth, economies of scale, positive trackable impacts and outcomes for children, families, and communities, and more. These would be our recommendations for the path forward. We want to thank you for your precious time and for this opportunity. We know we've exhausted most of our time, but if you have any questions either for us now or afterward, we'd be happy to respond.
Thank you both. You've really provided a significant amount of information and also access to some references that we haven't had earlier. So thank you very much. Questions, committee? Senator Weeks.
Yeah, just one generic question. So this is a briefing from Head Start on Head Start's program. That's my understanding. I'm wondering if you know that the federal government is actually willing or now legislating additional funding support for this program, or if this is kind of like a summary overlook on where Head Start could go in the future without additional funding.
Yeah, thank you for the question, Senator. I think the best response I'd have for you on that is I don't know that additional funding is being contemplated beyond things like, cost of living increases and things like this. I mean, if you're talking about expansion of the program to serve more children and families, I don't know that I've heard rumblings of that. But I will quickly say, in terms of the relevance for Head Start and this proposed legislation, if Head Start needed to pivot in Vermont to serving more infants and toddlers, that is not an easily achieved thing. We have set numbers, that we are funded to serve for preschoolers and set numbers around infants and toddlers. There are processes to go through to convert preschool slots to infant toddler, but it is not a one-for-one conversion. It doesn't happen instantly, and really, I think we would essentially lose capacity, for total
Okay,
numbers of
Thank
children
you,
served.
Paul, the answer was no. I just wanted to make sure that it was confirmed that this is a Head Start program review, but the federal government isn't in fact at this point coming to the table with more funding. I just wanted to clarify that.
Okay, I'm gonna, Senator Goulart, you had a question earlier and I don't want to ignore it. And then
Thank you.
Senator Hardy has a question.
I think you froze when I asked my question, which was simply, you offer a lot of great recommendations, but it seems like a lot of those recommendations are already included in the bill. So is it your, are you insinuating that none of those recommendations are already included in S56?
I think what we're saying, Senator, is beyond the CCFAP and some of the things that we pointed out that we think are fabulous, we see S56 really as an expansion of public pre-K to 4-year-olds throughout the state, but not making any movement specifically for the benefit of infants, toddlers, their families, the infant toddler workforce. What I said to Deb before coming to this meeting is, the way I think of it is, whereas we're on a car journey across this country, the suggestion in S56 is let's switch this car from gasoline powered to electric powered. I think that's a great idea. The problem is we have 4 tires that are rapidly going flat, and I think that has more urgency.
Okay, we understand. Senator Hardy has a question.
I have a comment, Paul. It doesn't seem like you've actually read the bill.
No, I read the bill in its entirety,
Yes.
Senator. I read the bill in its entirety. I just want to be clear for the record that I read the bill in its entirety. Took me several hours. I marked it up. I highlighted
I
it.
was
And I put
talking
comments
and
in
you
it.
interrupted me, and that is not okay.
Well, insinuating that I didn't read the bill is not okay either.
The bill, the major investment in the bill is in infant and toddler care in the form of the CCFAP program, expansions in access to childcare, and support for early childhood educators. That is the major investment in the bill.
Okay.
Yeah, we didn't see.
That's a
We didn't see
comment.
it.
I'm
we didn't see
going
it
to
that way.
say, thank you. That's a comment. And we have about 20 other people scheduled to just say a few words. I do want to say, it is clear to me that you've read the bill, so but the issue is around how pre-K is handled, and our committee and the education committee will be in dialogue about how that happens. We certainly don't want to ignore the critical nature of childcare and childcare improvement as we go forward. So we have a big job before us, and we will very much look at the testimony that you provided, because it's very helpful. So thank you very much.
Thank you, and thank you for the opportunity, Senators.
We're going to move on in our agenda. Theoretically, we're marking up S37, which we're not doing. But before we ask for comments from folks for Recovery Day and the RAD organization and the Lake Champlain Advisory Committee, it's a day for everyone today. So I'm going to ask Amron, did you have any homework assignment for us for S37?
Yes.
Yeah, for that. Yeah, I mean, good grief.
record, Amber Daily Legislative Council. This morning, hello everyone. Sorry. This morning you heard from Michelle Childs in our office on H89. We got an overview of what that bill does. Those are the criminal and civil implications of legally protected healthcare that House Judiciary worked on and that is now over in Senate Judiciary. So I wanted to point out that a couple of the witnesses for S37 mentioned the definitions, the changed definitions that are in H89, and recommended that the definition legally protected healthcare activity in H89 be used for S37. So I just wanted to point that out, that this will be something the committee will probably be discussing when we do markup. And I'm available in between now and whenever I'm back from markup to answer any questions about what has changed between the introduced version in S37 and what happened in H89. Issues around telehealth and licensure or non-licensure of physicians in the remote state where they're providing telehealth services. And then also the other issue I wanted to flag was that on the House floor, when H89 was being debated, there was a question about the use of insurers within the definition and is it unclear? So those are two issues that I think might come up during committee discussion during markup, and I wanted to give you a little time ahead of time to come to me if you have questions or to talk with Michelle about some of the discussion that happened on the House side so that you can be well informed for when we get to markup.
Thank you.
Can I ask you, or when are we doing markup on the?
Friday.
Okay, it's not on our schedule on Friday. Oh, yes,
Jen
there
Darby is on the schedule, so
I think I might be added.
Okay, I just want to make sure we have enough time.
We'll be checking that out. No, and next week we'll be doing more. So we're going with the flow here. But our goal is to complete markup on that bill by midweek next week. So there's a lot of work to do, but there's a lot of work that our ledge councils have been doing for us, as we talked about the other day. Yeah, go ahead.
So you're suggesting that, or saying that we will use the definition of legally protected healthcare that's in H89 or in S37? Is that right?
you had a couple witnesses for S37 who made that suggestion. And going back to a previous conversation that we had, the definitions should be identical in some way. So
Gotcha.
as Michelle mentioned, we're in coordination with both bills on making those consistent with each other.
Okay.
Thank you. This will be good. So we have our homework assignment, and we also, we're joined by, we have with us 3 different groups.
Sorry.
And so I'm going to introduce, I'm going to have you introduce your name. Allison is here from Rights and Democracy. I believe we have someone here from Recovery Day. Is that accurate? No. We don't have Recovery Day. We have Vermont Creative Economy. So I'm going to say, welcome. Each person has 30 seconds to say hello, and then we're going to welcome the Vermont Champlain Advisory Committee folks as well. So we're going to begin with Allison. You've been sitting there longest.
Thank you, Senator Lyons and members of the Health and Welfare Committee. My name is Allison Neihart. I live in Middlebury. Hello, Senator Hardy. And I'm the Vermont State Director for Rights and Democracy. We have 24 members of our staff and leaders from across the state testifying today. 30 seconds isn't enough time for me to share a full message. So I will just cede the floor to when you have an opportunity to introduce my colleague Zoe Silverman, who is in the room with you today to talk about our priorities for investing in overdose prevention. Thank you.
Thank you, and thank you for your patience. We're very much compressed in the ability to complete our work. We're only a morning committee. We don't have the luxury of afternoon meetings, and we will, as we take up opioid concerns and drug overdose, and we will be doing that in our committee. We will certainly listen to your testimony. Thank you. And so I'm going to move to, I think it's Hillary. Who is the creative economy?
Yes, that's me.
Oh, that's you. Welcome. Thank
Hi,
you for being here.
my name is Julia Doucette, and I'm speaking on the intersection between arts and healthcare and how they augment each other. And if I have time, I was told to prepare something, so I have, and if I don't, that is
Well,
fine too.
if you each have something that you can send to us that we can put on our webpage, that would be extremely helpful.
Absolutely.
And this doesn't mean that we won't have you back into committee. Please, that would be great.
And so, is it my turn?
And you represent?
So I'm Hillary Solomon, and I'm here with the Citizens Advisory Committee on the future of Lake Champlain. And there should be more people. If they're not there, they're coming soon. All of our presentations.
We've got Mark and we've got Robert. Yes, they're here, and I saw.
Oh, great.
Yeah.
Perfect.
Oh, there she is on the screen. Okay, and Wayne, welcome all. You have your short time, so.
We have a very short time.
And Denise is here. Wow, seems like all week for me. This is great.
One more.
So Hillary, did you want to make a comment?
Nice to see you.
Or
I think
Mark?
I'll just.
Okay.
Thanks.
Oh, this is the latest.
This is our latest action plan.
Okay.
Senators, thank you. I'm Mark Nod. I'm the chair of the Citizens Advisory Committee, and I know you're in good hands. We have very limited time, but our friend Senator Lyons was a longtime member of the Citizens Advisory Committee, and I'm sure she can elucidate on some of the items of the action plan. Some of them will look familiar, part of our priorities that we deliver annually to the legislature as part of our charge from our enablement statute. For those of you who might not know, the Citizens Advisory Committee is a governor-supported committee started in 1989. 10 citizens, 2 representatives, Representative Odie and Representative Dolan, and then 2 senators, Senator Brock and Senator Bray, are our legislative members. We're from a diverse group of professional experience and scattered throughout the Vermont side of the Lake Champlain Basin. We meet 8 to 10 times a year to hear from citizens and hear from experts related to issues impacting the Lake Champlain Basin, primarily around water quality, but public health and access and those other issues are included. So annually, we pull together what we've learned and develop a consensus document called the action plan, which you've got in your hands. And we have a call for priorities that as you're working through legislation and considerations that might be flowing through the Senate or the House, that you consider some of this testimony. We are challenged as an organization, a group of citizens, to develop consensus on a specific bill. We simply don't meet often enough in the dynamics of legislative process. We couldn't possibly get together, speak to a bill, respond to it, have consensus, and get back to you before you've changed something. So it's hard for us to do that to the extent there are bills floating through that our priorities might touch. We'd like you to take that into consideration. Our priorities this year, again, are related to aquatic invasive species. It's the single greatest threat to Lake Champlain. It's what we heard from the Commissioner of Fish and Wildlife, from the Secretary of the agency, and from our peers involved in the Lake Champlain Basin program. And yet the agency is shrunk its program down to 1 full-time equivalent from what was 3 with dramatically reduced funding. So we're asking you to consider mandatory boat decals, boat inspections, and some new funding sources to help support funding those programs and actually developing staffing to support and facilitate all of the citizens that are involved. There are 100 and, Hillary or Lori could correct me, I'm guessing 175 to 200 different water body associations that need to be mobilized to manage prevention, remediation of invasive species.
So I'm going to say thank you. We're past our time.
Okay.
Our time is really, at this point, it's more than precious, but I did want to reinforce the support that I have for you informing us as we go through bills. If you have something to say, if there's a bill that you've reviewed previously and we're looking at, it'd be helpful to have your information. Also to thank Rights and Democracy for being here, and that will come back to you as we go through our bills. And then the creativity of health and our creative economy, something we do need to hear about. Today's a day of intersection. This is terrific. So thank you all for being here. We appreciate it. And we're gonna give ourselves a wrap. Our committee is ended for the morning.
I'm just gonna leave you.
Oh, good.
Party favors.
Party favor?
Party favors. These are examples of stories of immigrant farm workers that we work with at the Open Door Clinic.
Okay.
And how we used the comic medium